It gives me a lot of pleasure to be here this evening, not the least of which is it's kind of a homecoming for me. I used to work here back in the 94, 95 when I was doing my master's degree at the U of C. I worked in the ICU and the Emerge here, and I haven't been back since, and I can still find places like the Coombs Theatre, so that made me feel good, because I hit Calgary and I'm really quite lost these days.
Now I'll interject here just to mention we cannot get the big screen up. We only have the small one at the back, so use that as reassurance or as background.
Well, having not a problem for me. Apology for you, but having been a nurse for 35 years, you learn to wing it. You just do whatever you have to do to get through whatever you have to get through, and we will do that this evening. One of the things I'd like to say to begin with is that I'd like to thank the Prostate Group Calgary for inviting me to come and present my research study tonight. Anytime you get involved in research, you become quite passionate about what you're learning, and you really want to disseminate that and share that with people that it might have an effect on. And so anywhere I can go to do that kind of presentation, I love to do. And so this is one of those opportunities for me. I also want to mention that I'll be beginning with a brief overview of prostate cancer in terms of the incidence and things that probably all of you know because you're in this because you've had prostate cancer or have prostate cancer and are awaiting treatment. I'm going to talk a little bit about the different prostate surgeries that are now being done in Canada. And before I discuss the study itself, and the study was two-pronged, and I'll go into that in my presentation. But I do want to say that this is specifically about the information needs of men and their partners about prostate cancer, and prostate surgery, and not about prostate cancer. And when I was doing the research, the men involved in the interviewing all said, well, you know, there's more to it than just the surgery. Absolutely, but we got funded by the surgery people way back when, so that's how it got that way. But the next piece is to look at the broader picture, because absolutely it is so much more than just the surgery. But this piece has been very helpful as well for people in terms of informing them if the decision is for surgery, what they can expect, and tips to get through the experience. I also want to preface my remarks by saying way back when I was a grad student at the U of A doing my PhD in nursing, I worked for Dr. Catherine Moore, who is a well-known nurse urologist, as a research assistant. And together we developed the first study about the information needs of men and their partners. And the results of that study were published in this book that maybe some of you saw a number of years ago. It was available across Canada, published by the Canadian Continence Foundation, and it was given to a lot of men in the pre-admission clinics. I think we had a run of about 6,000 of them. Well, this research now that I undertook was to update the information that was provided there, because we're doing quite a few different procedures now, as well as to discuss more the qualitative side of the information needs. So it's not just, I need to know this, 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 and this. It's about the touchy-feely kinds of things as well. And so we went into it in more depth, and that's what I'll talk about tonight. Okay. I don't know if there's any point using this, but anyway, maybe I just can read from it. But anyway, prostate cancer in the year 2000, which is last year, it was the greatest cancer threat facing Canadian men. It affected 1 in 8 men, and there was a mortality rate of 27, 1 in 27, sorry. It is third behind lung and colorectal cancer in cancer mortality, and it affects most men between the ages of 50 and 79. More than 22,300 new cases were diagnosed in 2000, and that's up 1,600 from those diagnosed in 2005. And those figures are just on the rise. And of course, we have a whole population of men in that generation that is greater than the population that has ever been through that age span before. Approximately 20% of these 22,000 men will undergo a prostate surgery, or approximately 2,400 a year will opt for prostate surgery as their treatment of choice. Other options besides surgery, if the tumor is localized to the prostate gland, is the external beam radiation therapy, interstitial isotope seed placement, and watchful waiting. And I'm sure all of you are aware. Is any of this new information for people? It is.
We do have a couple of people here who are just getting ready to make a decision.
All right, good. Well, there are, and a lot of it will depend on your particular cancer and how far it has spread, if it is outside the capsule of the prostate gland. And this is what your physicians will be helping coach you about, because not all treatments are the best depending on what your situation is. Only in early stage is the surgery considered one of the best. There's even other new things like cryosurgery, cryotherapy, and that is more for secondary cancer where there's a degree of spread beyond the prostate gland. It's this decision making that is the most challenging part of the first stage of knowing you have cancer, because the option, and all of your health professionals will let you know, it's up to you, we can't tell you. And you will be seeing different individuals, and a surgeon will push surgery, and a radiologist will push the benefits of radiology, and et cetera, et cetera. So you really have to try to inform yourself as much as you can so that you feel comfortable with the decision you have made. In terms of prostate surgery, if that is indeed the decision that has been made, the first prostate surgery was performed back in 1904. I don't know if that's a statistic or a bit of historical tidbit that any of you knew, but you sort of wonder, 1904, what was the anesthetic like, and what were the surgical instruments like, and how sterile were things in 1904? Anyway, they did have germ theory then, so they were worrying about germs. Anyway, radical prostatectomy is a common treatment of choice when the disease is detected in the early stages. There are two types of radical prostatectomy performed today in Canada. One is called the RRP, or the traditional radical retropubic prostatectomy, and then there's the laparoscopic radical prostatectomy, the LRP, which is increasingly available in Canada. And we happen to live in a province that has the money to buy some of the technology that is required for doing laparoscopic radical prostatectomies. But that is not the case, of course, across Canada. And Edmonton is the leader in some of the more innovative technological advances in surgery. And they've got money and physicians who've been trained, and they are doing robotic laparoscopic radical prostatectomies. Right now, and Montreal is as well, but not Toronto. Western's got a machine donated, but nobody knows how to use it, and it's extremely expensive training to be using these machines. But it is one of the waves of the future that is coming along. However, your general surgeon, your general urological surgeon, is most experienced in doing the traditional radical retropubic prostatectomy, which is where they do an incision, they go in and cut the prostate out, as opposed to the laparoscopic. And I'll go over the two different surgeries. The advantages of a radical prostate surgery is that it's specialized equipment and training isn't required. So your general surgeon, urological surgeon will have learned this procedure along the years of his training and will have done a number of them. More urologists, therefore, experienced in this surgery, and it's available in all major centers of Canada. In terms of the laparoscopic radical prostate surgery, the advantages are there is diminished postoperative pain. Now, some men would say that's questionable depending on how much gas you have, because you can get a lot of gas production resulting, or gas trapping as a result of an LRP, and I'll discuss that further when I talk about the procedure itself. There's decreased operative blood loss and transfusion requirements, supposedly shortened hospital stays and convalescent periods, although the research is still out on that. You might get a day less if there's no complications if you do an LRP as opposed to an RRP. Research is focused on the ability to improve function without compromising disease control. And we're talking about improvement in function of your ureter, so you're not incontinent, and in terms of impotence. Those are the things that are, of course, the most common problems that men are fearful about, and rightly so, in terms of their sense of well-being. So they are promoting LRP as possibly a way to reduce those side effects. But again, the research is not out that necessarily this is true. Part of that is because you have so many new people learning to do LRP, it's going to take a critical mass of people with a lot of experience before you get the numbers to compare. It may reduce treatment-related morbidity, such as the incontinence and erectile dysfunction, but there's insufficient evidence. In good research, one chooses a theoretical basis. I teach research courses, and so I'm going to give you a little Research 101. Any good research should be based on some kind of theory, unless you're testing a particular theory. So in terms of this study, our theory was the theory of uncertainty and illness. And this was put forward by a nurse back in the early 80s, actually, and published over a number of years. She's refined this theory. And basically it is that uncertainty and illness is defined as a cognitive state resulting from insufficient cues with which to form a cognitive schema or meaning of a situation or event. Well, common sense, if you don't know something, you're uncertain about something, you're a little anxious about it, obviously. Managing uncertainty is critical to adaptation during illness, and knowledge and information are the primary resources for managing and reducing uncertainty, which is one of the reasons people come to these groups, is to learn things to help manage the whole situation that you're dealing with better. So even though good research uses theories, sometimes those theories seem like, well, it's just common sense. However, unless it's researched and proven, common sense isn't enough of a reason for promoting certain ways of things being done. Additionally, the need for current information to reflect new treatment options and resources was required. I mentioned the before and after radical prostatectomy booklet that was published back in the 2000-2001. It didn't address the laparoscopic experience, and that indeed was becoming more prominent, certainly in the Edmonton area. Revising this was a component of the project, and a method for revision needed to be informed by expert patient. And there is a whole movement out there that maybe you're aware of that says listen to the patients. They've been through it, they know what they need, instead of people sitting in an office and saying this is what I think they need to know, and putting out patient information based on what professionals think you need to know. What we wanted to do was develop a booklet based on what the men and their partners told us in our interviewing with them, so that it would reflect their experiences as much as possible. So the purpose was to explore the experience, focusing on their information needs. We say out there in terms of resources available in clinical practices pertaining to prostate surgery, and we wanted to revise that booklet. In terms of recruitment, we went through an institutional ethics board for approval, as everyone needs to do in our Capital Health region and Calgary Health region. And there were 3 sources. We had an existing sample pool of gentlemen from a clinical trial who had ticked on a box saying, if there's any further research being done about prostate surgery, call me, I may be interested. So we contacted those men based on that, ticking that box for that study. Then we also contacted the Prostate Cancer Support Group in Edmonton and talked to groups like this and asked people to volunteer to be in the study. And people just told friends, word of mouth. The inclusion criteria were men who had undergone prostate surgery and their partners. They needed to be able to communicate in French and English, obviously. French because I speak French, so if there was some difficulty, and there's a fair number of French people in northern Alberta, and they had to live in the general area so that they could come. They signed consents indicating that they felt well informed about the study, and they agreed to respect the confidentiality of others because, of course, there would be things revealed that should be kept confidential. In terms of data collection, literature, notes from our support group meetings, focus groups, there were people who couldn't attend the focus groups who sent us written feedback, and we included that. Then we analyzed that data, developed a booklet, came up with our themes, went back to a prostate support group, got their feedback again. Did this fit? Did this seem to be the way things, did we represent what you said well enough? We also went to physicians, the urologists. There were a few urologists involved who reviewed it to be sure that the medical piece of the information was accurate, and there was a couple of urology nurses who also reviewed it. And then we made those edits, brought it back to the group, another focus group, and discussed it until we got a final document. There was 2 types of analysis that we did. We did content analysis of all the things that we were told that had to be in the book. So those are just points, content that we had to put in the book. But then we did what was called an interpretive description, and this is qualitative research as opposed to quantitative research, which generally is done traditionally done in the sciences, where you do count things and you do percentages and statistics. We weren't interested in what the average guy said. We were interested in what everyone said. So we included all people's experiences, from the most different to the most average, so that you get a full range of the kinds of experiences and information that people needed. There were 2 men who, although we said you had to have prostate surgery to be involved, 2 men showed up at the focus groups who had not had their surgery yet. They were keen to find out as much as they could, and they were going to every meeting they could that was offered on anything to do with prostate cancer and surgery. And there was no way we were turning them away, because we wanted to hear what they thought they needed to know before surgery. So that was an important component that we hadn't considered might be of value. And those men both had their surgery, did elect for surgery, and came back for the second focus group having gone through the surgery. So, we got their information as well in that respect. 2 people had been involved in their surgery elsewhere than in Edmonton. So we had somebody who had been in Calgary and talked incredibly about what you've got going on here, where it's kind of like one-stop shopping. What is it called? Where you have all that, everything about prostate is in one building. Institute. Yeah, you walk in and you go through everybody, and it was just phenomenal. And other centers are starting to try and put that together, because that is one of the best ways of meeting information needs, if you can go to one place and visit everybody. One of the other people had gone through the experience in Victoria, and that was an interesting experience and really informed us about other ways of providing information. So I want to jump to the content analysis. Sorry. This is the information we got to put in the booklet. Information needs were grouped under 5 phases, and the men said that this worked best for them. As soon as they're diagnosed, this is the kind of information they want. When they're at home waiting for surgery, this is the kind of information that they needed or would help them. Then when they go for the surgery, there's certain kind of information they needed in hospital post-surgery and at home post-surgery. These are all reflected in the booklet that is actually going to be produced by August. It will be online, free in French and in English. Okay, in terms of the interpretive description, there were 7 overarching themes. They wanted an integrated information delivery, which is what you seem to have here in Calgary. So were you guys to have been involved in the focus group, we probably would have gotten feedback that this experience here is so positive because you've got a one-stop shopping. They also wanted information for emotional support. Many felt that it wasn't, how they were handling the situation emotionally wasn't asked. And being men, they weren't going to say. And so if it's offered and put, if it's put on your plate, you might eat it. And they really felt that a lot more men would benefit from that, were that opportunity there. So that in your one-stop shopping, you absolutely stop and talk to a psychologist. It's just there as one of the people you meet and you tick off, I've done this, 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 so that that person can explore how you're reacting to this. Because a lot of men go home and have their concerns that are valid, and they have the wives wanting to support them, or their partners wanting to support them, and the partner needing support for supporting them. And they just feel that this whole emotional support piece is understated, underused, and available out there. They wanted information about healthy living. They felt that that was a huge piece, that getting yourself in the best possible shape to go through your surgery means that you will have a better experience with your surgery. So what is all the information you need to get yourself on a diet, exercising, etc., so that by the time you do have your surgery, you're in the best shape you possibly can be. They wanted reliable and timely information. So they didn't want everything handed to them one day, once, and you're supposed to remember it all, and you never get it again. So it had to be timely. It had to be at different stages and repeated. And reliable, they wanted it to be told by someone that had credibility, of course. They wanted frank and honest information. They don't want people to hide what the side effects can be. They need, if they're going to make the decision to do one or other of the treatments, they want to know as much as possible. I mean, what can statistics tell you? You can always be the outlier in the statistics, but at least you've got as much as you can get so that you can make as informed a decision as you can. They wanted the information for the partners. The partners needed to be there, and some of them talked about, some of the partners spoke of breakaway groups during the support meetings where they went and talked about their needs in terms of supporting their husbands or partners in this. And they wanted an opportunity to share stories. That was really important. And this does come from support groups. I even heard some of you doing that, of course, out in the lobby. I mean, this is what is your common bond, is this prostate cancer is your bond. And some of you have been through surgery, some of you have been through radiation therapy, and sharing those stories helps inform others, but it also helps diffuse the experience for you. Okay, so in terms of integrated information delivery, which is the first theme, they wanted ease of access to these resources without needing to be referred, because most men didn't want to go to their doctor and say, would you please refer me to a psychologist? It isn't the nature of men who have been running their lives fine to have to admit that maybe they're having some difficulty dealing with this. But many men do have difficulty and try to hide it, try to bury it, and it comes out in other ways. So they just want it as something that is just there. You just are going to go and have a chat. no one can force you, of course, but it's an opportunity where you don't look different from anybody else for having walked into that person's office. They also, in addition to the urologist and the GP, they wanted to be able to access nurses, pharmacists, and physiotherapists easily, so that if they needed a physiotherapist to do their exercises before surgery, that's very available for them. And mental health professionals. They wanted to get the booklet about surgery when they were diagnosed from the urologist, not the day before surgery. Because there's all kinds of stuff in it about the, after making your decision, waiting for surgery, that if you get it the day before surgery, it isn't of any benefit to you. And they really would like the opportunity to go through the booklet with the nurse. So not just being handed a book and read it and figure it out yourself, they'd really like it to be handed, to be discussed. In terms of informational support, I think I've pretty much discussed that. There can be an issue accessing mental health professionals if you don't know how, but many men have questions such as, and these are their questions that they shared with us. Who am I as a man? Am I cured? Am I going to survive? Can I still earn a living? I felt good before the surgery, so why don't I feel well now? All evidence of that uncertainty we talked about, and it needs to be talked about. In terms of the reliable, oops, not in the same order as. The reliable and timely information, obviously it helps you cope, it helps you plan, and it helps you with your recovery. And it depends on where on the prostate cancer continuum you are, from just having found out to towards the end. At diagnosis, they need to deal with what the diagnosis means, so it's a different focus at that point in time, then deciding on the treatment options. And that's where most of our participants felt that the services and information provided were the weakest. And I guess I just would like a show of hands, you people in Calgary, how many of you have gone through that prostate, what is it called again? Prostate Cancer Institute. How many of you had experience with it? Wow, good. And was it as good as we think it should have been?
I think we've got something confused. Prostate Cancer Institute is where we get all our biopsies done.
But don't you have an opportunity to talk to a psychologist there and an opportunity to see?
The psychologist is here.
Yeah, there is.
So it isn't one stop?
There is an entry, but I can't remember what it's called. That almost none of us probably have been to. Has anybody been here and met with about 5 people?
No.
So, okay.
Yeah, there was a nutritionist at the one we went to a couple weeks ago, and there
where was that? Where was that?
It was at the Prostate Institute on Glenmore.
Okay.
So there was a nutritionist there, and then there was the psychologist there, and I've got tons of paper at home. Who else was there? The physiotherapist was there.
Okay. And did you meet individually with each of these people?
Well, there was a group of us. There was about 6 of us there, and they gave us all their documentation, all their phone numbers, a list of you know, to contact them after should we want to. They talked about the exercises. Yeah, it was about an hour and a half before our doctor's appointment. We just happened to work out.
Okay. Yeah, and I think we're finding that this kind of information is reaching the physicians, and they're realizing that there's so much more they can be doing about this information piece to allay uncertainty and for you to know where you're going to go. So this seems like it's part of the way there. What these men were talking about is that you actually go in for a day and you have appointments and you see these different people for half an hour each. So that isn't happening here. Okay, I thought it was. That was the impression I got. But trying to find this information is not easy online, and unless you know, I have this opportunity to ask you.
They actually offered a program like that. Well, we looked for volunteers where I volunteered for it, and you had a private consultation with a nutritionist, a private consultation. It was all free. Somebody donated a bunch of money and had a physical activity, so you went for 10 weeks, and they took you to a gym.
And was it valuable.
Oh, yeah, it was, I
See?
learned a lot that way, but it was all integrated, they had to volunteer for it.
So it's probably part of
It
somebody's
was all
study.
prostate cancer institute.
Yeah. Oh.
No, this is a program that has been going on for quite a while now. Where you can enroll in an exercise program, etc., and meet with a certain psychologist. That has been going on for quite some time.
Through the institute?
Through the institute. However, what this lady is talking about up here is an advance of that, where the various urologists and various other people will get together and meet with a group of people, not individually, and sell their particular trade to those people. That's in the embryo stage,
Okay.
and just getting off the ground.
Okay. Okay.
We did too, yeah, we met with the radiologist, oncologist,
Good.
urologist was there, and then the second session was the dietitian, the physiotherapist, the, whatever they were.
And this was all to help with decision making, as well as
Not so much,
Just to show what they were doing.
it was like, you know, should you, whatever you're gonna, like, proper healthy eating, things to watch for in your diet, the Kegel exercises.
Okay.
Did I say that right?
You did say that.
Thank
Very
you.
good.
And everything to prep. There were some individuals, there were some gentlemen there who had had the surgery that were really helpful in discussing, you know, all the stuff that these individuals were talking about. They gave us all their website numbers, and a list of different places to go for exercises and that were free, and it was quite informative.
Good.
But it was after we met with the 3 doctors that did the presentation initially on the various choices.
Okay. Okay. Good. Well, you know, it's coming into its own. The information is getting out there. Of course, it takes money. It takes will. It takes physicians to see beyond just their particular mode of treatment and coming together into a, you know, into a practice even, where the practice is not surgery. The practice is about prostate cancer and you know, alleviating the uncertainty for people. So I appreciate getting that information. One of the other things that was recommended a lot is that positive attitude, having a positive attitude about things. And hey, you know, our generation knows that, don't we? Obviously, you don't get through life if you don't think positively about things. And this is accomplished by engaging in pursuits that were most enjoyable, taking up new activities and hobbies, keeping up with previous activities, and positive self-talk, such as I'm going to win, I'm in charge, and what resources do I need to get? So taking control of the situation as much as you can, and not letting yourself become a victim to it. And they talked a lot about how good it is to take a holiday with one's partner before you go for surgery or any of these treatments. If you can. Not everybody can afford that, of course. Oh well. I'm just going to go on with what I have. They wanted frank and honest information about pain, incontinence, erectile dysfunction. They wanted a balanced presentation of the negative and the positive. And sometimes you get a very imbalanced presentation that, hey, you know, you're just going to be incontinent or you're going to be impotent. Expect it, and if you're not, well, you're lucky, you know. So they wanted to know what the statistics are. That gives you the balance. The numbers give you the balance. And you may not be the statistic you want to be, but at least you have some idea of what the odds are, I guess you could say. Because it's a crapshoot, excuse my terminology. But in terms of making your choice, it often is, you know. They want to know about the pain and discomfort that you're going to go through, because sometimes they'll say this is laparoscopic, you're not going to feel anything. And then, my God, you're overcome with this gas pain, and you know, you can barely stand, and you think there's something wrong with you because they told you there wouldn't be pain. So that frank and honest information. They want discussion one-on-one with health professionals and about treatment options. And they want this soon, because there's a lot of things, the sooner you start, and a lot of physicians are uncomfortable talking about this kind of stuff. Or they'll just talk about it in a cursory way, yeah, you might have some erectile dysfunction, let me know if you want to do something about it. Instead of saying, well, this is what we can do, these are things, if we're going to do them, we better start right, 6 weeks after you come home, or we'll start some of these even before you go, et cetera, et cetera. So you just need to have a little bit more, who's that nurse on TV who talks so openly?
Sue Johansson.
Is that?
Sue talks.
No, not her. There's somebody who talks about sex, like
Yes, Sue
Sue?
Johansson. Sue Johansson.
Okay.
But she's retired.
She just retired.
Just retired, okay. So Dr. Johansson, or do they call her Dr. Sue, or just Sue? Just Sue, yeah. Maybe it was Dr. Rude. But anyway, you just need, you need to get right to the basics and talk about it. If it's important, like not for every gentleman, is it that important at a particular stage in life? It just all depends, and that just needs to be clarified and qualified. In terms of, oh great, so my battery's unplugged. In terms of, in terms of information for partners, they also needed to know about support people. They needed updates during surgery. How many of you went through the surgery and wanted to know how things were going?
How do you mean?
Well, you're waiting for your loved one to come back from surgery. It seems to be taking a little longer than you thought, whatever, and you're just sort of wondering what's going on. So there was just one lady who felt that she wanted, you'd like to know too. Yeah, and it's easy enough. All you have to do is just talk to the unit where he's going to go and ask them to call for an update. These are the sorts of things that can help allay anxiety and worry.
My wife went out to lunch, and one of her friends suggested she go and play golf. But she declined that.
And for some people that would work. It would never work for me. I'd be outside that OR door, just wondering if they're doing it right. So every person handles these kinds of things differently.
That's because you're a nurse, you know what can go wrong.
Exactly. Some partners felt anxious and unprepared for the discharge. All of a sudden, they go in to visit and they're told that the person is discharged home. And this was true of a number of the partners who were in our study who said, I wasn't taking him home. He had that catheter, he had this, he had that. And there are people who feel that way about that kind of care and feeling concerned about their ability to deal with it. So knowing about those things ahead of time can really help alleviate that kind of concern. Sometimes you need an opportunity to vent, and people will form their own networks to do these sorts of things with your children and whatnot. We're just saying that we as health professionals need to be aware of how important all of this is to men and their partners. Sharing stories, as I mentioned, it engenders support and it helps to provide information for both the teller and the listener, and at different stages along the continuum of your illness. This period is a life-altering period, and sharing stories is a way of acknowledging the life-altering experience. The prostate support group networks were found to be invaluable for those who go to them. But I wonder about those who don't attend meetings. Is there reasons they don't? And that is something we want to look at in our further study, are there marginalized people who wouldn't feel as comfortable because of their culture, because of their sexual orientation, what have you, about being part of a support group the way they exist now. And the information that is provided needs to be more than once, because and sharing your stories helps you normalize that. Yeah, we all have the blue days and our up days, etc., etc. Now, the information about healthy living, I've mentioned that. It helps with the waiting time because you're busy doing something that you can do to better your chance of having a better outcome in terms of whatever your treatment option is. The physical activity, healthy eating, weight reduction, tobacco cessation, all of these things can only improve your overall health. You need ready access to health professionals about this and having that positive attitude that I've already spoken of. Okay. Okay, now in terms of discussion, this is the stage at which you compare the results that you have to what others in the other researchers and scientists have found. And basically, what we determined in reading the literature is that other people's studies supported how the booklet was developed, and that these different themes, the integrated information delivery was supported in the literature, that this is important for what works best for men and their partners, and because it can result in significant increase in both patient and staff satisfaction, because the staff are satisfied knowing that you have the information you need. There is some problem, as we've alluded to, with territoriality and lack of understanding of the roles and barriers to breaking down, to sharing the different roles so that you get the information from the different individuals in a way that doesn't put another professional down. Well, don't have surgery, really. The best thing is to do this. There are some places where still those are problematic, where you get a biased view, perhaps, of a particular treatment from a particular professional. In terms of limitations, there were limitations to this study, and this is the way when you report studies, you always talk about the limitations, because it's being honest about the things you could have done better. Basically, the participants self-selected, so people chose to join the study. What about people who maybe didn't hear about it, or people who had negative feelings about prostate cancer support groups or what have you? Would they perhaps have felt as comfortable joining and being involved, because these were done in focus groups? Most of the men were from similar socioeconomic backgrounds, so it makes you wonder. Most of them were fairly educated. Are we getting a good cross-section of the population of men who are having prostate surgery? It wasn't necessarily reflective of the experience from other than Western Canada, because we did have participants from one from Victoria and from Calgary. So maybe it's different in the East. You go east of Alberta and nobody's getting laparoscopic surgery until you get all the way over to Montreal. It's difficult to recruit individuals from rural or small towns, although we did have that as something we tried to do, because I think the experience might be different when you live in a more isolated locale where there isn't a group of people that you can get together with and share stories with. Yeah. So in conclusion, basically, among men diagnosed with prostate cancer, the event of diagnosis triggers uncertainty for them and their partners about the prognosis, treatment options, information for decision-making, the possibility of incontinence and impotence, and particularly for the men, uncertainty about one's maleness and how the diagnosis and treatment chosen will change one's relationships and life in general. Without adequate social support from your family and friends, and support from health professionals to provide the needed information and knowledge, the uncertainty is not ameliorated. And I have a final quote that has been provided by Arnie Goodman, who's the president of the Prostate Cancer Support Group in Edmonton, and he said I can use his name. In fact, when I asked him, he said, "Oh, people always wanted anonymous. I don't mind standing up and saying that this is what I've said." And I agree. Like, I'd love to tell everybody about who our participants were because they were so valuable to us. Anyway, a positive attitude, information seeking, the will to succeed, Sound professional help and information, and the faith and love of family are needed to successfully come through this and deal with what the future holds. Remember that you and your partner are going through this together and dealing with the recovery and the resulting side effects together. Your partner's involvement in discussions pre, during, and post-surgery is paramount. 2 sets of ears are better than 1. Thank you. That's all I have. Mention my acknowledgements. Of course, all the participants, the men and their partners, Athabasca University Academic Research Fund that funded the study, the Prostate Cancer Support Group of Edmonton, Karima Afchar, who translated into French the booklet that will be put online, and Drs. Hobart, Este, and Pianazza, who provided their information. So, questions? Yes?
Yeah, I've got 2, if you don't mind.
No, not at all.
The first one is that you never mentioned biopsies, and I had a dozen biopsies, and I'd sooner have the operation a dozen times. I drove up Deerfoot Trail and can't remember driving home. The other one is much more important. I was always told that when I gave up sex, I'd get rich. And 7 years ago, will you tell me when I'm going to get rich?
Did you give up thinking about sex? Well, there you go. You got to give it up completely. In terms of the biopsies, I know what you're saying. I have a husband who's had 2 biopsies, and he refuses to go back. And of course, here I am saying, "You go back for those biopsies, or I'm doing them myself." Because the pain is so intense. Yeah, and
well, it's repeated too. It's not just
yeah, exactly. I don't talk about that because the biopsies have occurred before the decision making for prostate surgery, so I leave out that.
They advised an analgesic beforehand. I don't take pills, so I didn't take it. So that probably had a bit of effect, but I don't think any pill would overcome that.
Yeah, actually, apparently they're starting to use freezing.
They need to freeze.
Yes.
But the thought of
Get it done in
freezing.
the winter.
Yeah, I think it's terrible to have to go through that kind of thing, for sure.
So, I went through the biopsy, and I didn't know. I drove myself down, had the biopsy, drove myself home, went back to work right away, and then read on the internet that you should be resting for 3 days after. So, if you don't know,
Exactly.
sometimes it's good.
Exactly.
The other thing is, 4 years ago, I had radical open surgery, prostate surgery, and was in the hospital 8 days, and have come out of it very well. My brother, right beside me, just here last month, had laparoscopic. He was in a day and a half, which disappointed me. I was hoping.
He went to visit and he was gone, right?
No, I was going to visit him, and he phoned me, and he says he's home already. So I just quit visiting him. This is the first I've seen him.
Well,
So
it does.
Things have changed an awful lot
Well,
in 4 years.
Oh, absolutely. And our radical is about 3 days now. And our laparoscopic tends to be 2, is what I'm told. You were 1, were you?
No,
were you just going to walk out? Or were you one of those guys? That's it, I've had it. I'm
Oh, it was
out.
actually 2 days. It was 2
Okay,
days.
yeah, it's
You
usually
can't
2.
always believe. Never could.
Thank you. Yes.
Can you discuss cancer stages?
Not authoritatively. No, I know enough. I know about them, but I don't know enough about them to feel comfortable.
Well, you mentioned cryosurgery procedure for secondary cancer.
Not for for when it has spread beyond. Yeah, yeah.
Well, we had a diagnosis in April for cryosurgery and a projected surgery date for upcoming August the 5th. Nothing in between. I did submit a lot of questions asking Gleason counts and stages and everything, and we just had pre-admission just today and this coming Friday. That's all the information we've been given.
Well, you must be slow growing. I mean, there must be something where they're able to determine that it's a very slow growing. But
make sure that you you know, some of the people here will probably talk to you after the formal part of the meeting.
About cryo.
Could we? Yes, yeah.
It
I'll do
depends-
something here
Yeah,
for you.
and it depends on if you're in an intermediate to high-risk group. That's more where they use cryotherapy.
The stage is 2A.
Yeah, okay.
Don, did you have a question?
In that regard, we have at least two gentlemen here, and probably more, who I will go to when I need more information. Ben Dreger and Mr. McHenry.
Right.
I've heard doctors that sound like kindergarten teachers compared to these guys. So don't hesitate, they've been through it all.
But we don't give any advice.
No advice, just experience.
Tell us your story.
That's right.
Yeah?
Secondly, I wanted to mention that you,
Absolutely.
I've just, all we've learned is what I've learned on the internet.
Right. Every one of us here has probably gone through exactly the same procedure.
Our problem too is other complications like heart. And
Yes.
emphysema
Right.
And so you're not a candidate
And we'll come
for
to that.
surgery.
See, we'll come to
Yeah,
that.
that's true.
the second thing I want to mention was that you mentioned support groups and friends and relatives and whatever. When I was diagnosed and was told I was going to have, or we decided on surgery, it was 2001. I was fortunate that I had a friend that went through the surgery 3 or 4 months earlier. He came over and we spent 2 or 3 hours. He told me how I'd feel on day 1, how I'd feel on day 2, how I'd feel with the bag on, when it was changed at night, put onto the day bag, how I'd feel when I got out of the hospital and had to stop in the park to have a pee and turn the tap on. He went over everything, including the fact that, I think it was after the second day, he says, you'll wake up in the morning and you'll feel like a prize bull. And I want to tell you, if I didn't know that was happening, that would have been a little scary. But I knew it was happening and buzzed the nurse, and she brought in a bag full of ice, and the problem was cured. But if you talk to somebody who will give you how they, especially if it's recent, what happened to them on each day of the 3 or 4 days they're in the hospital, boy, is that very helpful.
Well, and you know, there are some disease processes and injuries where a burn patient, they have in their support group, they have individuals who go out and actually talk to newly diagnosed people, and you're kind of buddied up with someone so that you go along the journey with someone that you can talk to and you can ask questions of. And I think that's really a good idea, and I think that we might thinking of moving that way more in our prostate support groups, where we actually buddy up with people if you have the time.
We do that quite a
And
bit.
You do already.
Well, we do that at a Gappy hospice too, I volunteer there.
Right, yeah. It really does make a difference. And certainly some of that we've addressed in the book where we've talked about, I should put that in, feeling like a bull. It's not. I put in that you're swollen.
I didn't mind.
I didn't do the.
I would prefer to look like a bull, but I only
And you may not want to put that in, because that doesn't happen to all of us.
But that's the one thing in the book we tried to cover. We say some men will feel this, other men will feel that. So the gamut of possible feelings or experiences is involved. So if you don't have someone that is at your side telling you things, you can find it in the booklet.
Any other questions here, Ken?
Yeah.
In the book, which is dedicated to radical prostatectomy,
Yes.
do you list a number of links
Oh,
to
yes.
good sites?
Good point. We have, it's called a resource guide as well. And so the last 2 pages are links, and we've got good books to buy, you know, the better books in terms of, and Canadian. We've got Canadian links because our situation is different. Many of the American links they're trying to promote their own treatment because they're money making, and so you just really don't know how much you can believe some of the statistics that are out there. So we really focus on Canadian. We talk about why we focus on Canadian in the booklet. Yeah, that's a piece of
Do
it.
you cover Parton tables?
Do I cover what?
The Parton tables, the chances of failure or success. You know, it's part.
Yeah, but
He's got a bias too. He'll only accept patients that are practically cured before.
Oh, now I know what you mean. Yes, no, we don't, yes, I do know about that, but you're right, he
I remember
does.
looking it up, and if you know your three risk factors, or what would you call it, your extremeness of your prostate, what do they call that?
Well, isn't it?
No, not, yeah, okay, you've got a
PSA,
police
please.
count, a PSA, how high it was.
Staging,
Yeah.
you're staging.
So, I remember on the Parton tables, I read 28% chance of success.
Yeah.
I didn't bother calculating that was 72% chance of failure. Guess what? It failed. I just love rolling the dice.
Yeah, no, we don't refer to those.
One final question, Tom? No?
Yes.
Just a comment, you didn't mention this, but it's been well illustrated in the group discussion, having a sense of humor.
Yes.
Yes. We've got that kind of a positive attitude, but you know, I think that's a good point, and I can still add that. Be more upfront that that's what we mean by a positive attitude, is take it a little further than just, yes, I'm going to get through this, but laughing about it, you know?
Yeah.
This gentleman
Yeah,
here.
that's good.
Yeah, thinking of the stage beyond the hospital. I mean, I'm 2 years out, so you think you understand all the steps and all the issues surrounding incontinence and so on. However, much as you think you understand it, every once in a while, the whole situation overtakes you, and there's an issue, and you don't. Most of us do not want to run to our doctor, you know, here higgledy-piggledy with what might to us seem like a small issue, but it is bothering us. So, you know, one of the suggestions that comes to my mind is that if you had the ability, or if we had the ability to phone a health professional, rather like the Calgary link or the equivalent of it, and say, look, I feel this way today, or at this hour of the day, and talk to somebody that understands the issue that you're going through, and that can talk you through it. Because a problem shared with somebody that can really provide the answer immediately, you know, rather than, I mean, you can talk to a friend, but if you can talk to a professional and you're worried about some particular issue.
You know, that is excellent, and I know that my colleague, Dr. Catherine Moore, gets those kinds of questions. She's a urology nurse, and I think that that's a great point, that we should be promoting that role of urology professional and providing phone numbers to those individuals, because they do have the expertise, and you can get them. Because
and it helps, you know, like in reality, you know, if you knew that service existed and you're trying to deal with it, and your wife says, well, do something about it, you know, or, you know, is about to give you a kick in the rear, well, you can pick up the phone and say, well, look, I've got an answer. So the problem is dealt with.
Was there a final question?
Yeah, that's a great point. Thank you.
Gentlemen, yes.
Just want to comment, you talked a lot at the beginning about access to a psychologist. I attended the 2 different sessions at the Prostate Cancer Institute that the lady over here referred to, and in the second one, which I got, I think, about a month after diagnosis, they mentioned, you know, the Calgary Health Region provides for prostate cancer patients free access to a psychologist. And I remember thinking, I mean, what a tremendous service that is. It's too bad I didn't know about that the day I was diagnosed, because it's that first 3-4 days after diagnosis that are emotionally, you know, the hardest. The urologist in my case didn't really give me a very good outlook as far as success. Left the country for some other work, and the next few days were just absolutely horrible. And to discover this service had been available. So at that session, actually, I mentioned to the guy presenting, I said, you should tell the urologist to tell the patients that this service exists. And his comment back was, we've been telling the urologist, but the urologists say the patients don't really want that.
I know. I know, and that's why we're saying give the patients this book the day you, and I'm presenting to the Canadian Urological Association on the 25th. And I'm trying to get the message across, you know, and of course, they see this as soft science. because we
Because
talk to
that's
people.
important information whether you're getting surgery or anything.
Anything, so the
Or what
urologist, you know, but I'm saying that's in this, it happens to say it's about prostate surgery, but it's also, I think it should be given to people before they decide to have surgery, because it has all you need to know about the surgery, and it's one of the things you might get, but it tells you, get in touch with a psychologist, it's available to you. Yeah, good. Thank
Did you
you.
know that the Foothills does not have a urology department?
Yeah, they don't. It's
Is
all
it
in the
all
other-
under medicine?
Solid rock.
Oh, you put it all in the other
But
hospital.
you register at the Foothills, you come to Tom Baker, and then you're transferred to the Rockview.
Yeah.
Isn't that practical?
Virginia, we want to thank you.
Okay.
Yeah,
I'm
really
well,
good.
I'm
We'll take this.
willing to take questions after.
Yeah, we'll take some after.
It was just a comment, not a question.
Okay.
Do you want to go ahead?
Yeah.
I just went through surgery on the 25th of April, and you mentioned support systems. And one of the things I found very, very supportive was the aspect of spirituality. And sometimes we fail to talk about spirituality publicly. And I was on 3 different committees with the health region. And here at the hospital, we had a program where we took 40 nurses and 40 social workers and trained them in spirituality, put them on certain wards, and it was extremely successful. And it's an old-fashioned way of looking at things, but it can be a tremendous support to you and your friends, to whatever your spirituality is, to look at it, and it will probably help you as much or more than a lot of the professional help that you can get. I just say that. I think
That's
we
an
have to
excellent
consider.
point. Thank you.
Please sign up when you get out here on the page that tells you you'll get the newsletter every month, especially for anybody new to the organization. Sign up, we'll get a newsletter to you every month. It'll tell you who the speakers are, it gives you some other information, and it's free, and you'll continue to get them every month.
On behalf of the group, Virginia, thank you very much.
Thank you.